Doctors and nurses of Reddit, what's your he shouldn't have survived story? We had a guy come into ER because he was feeling kind of dizzy and out of breath. They ordered a standard array of labs, and when the lab, drew his blood, we noticed that his blood seemed really thin and watery. That was because he had a ducking 2.7 hemoglobin. For those of you who know hemoglobin values, I swear on my mother I am telling the truth that this man was both walking and conscious when he came in. He even argued about being admitted overnight. We couldn't even get his sample to run at first. We had to duck with the sensors for it to register. For those of you who don't know hemoglobin values, it's basically measuring how much blood is in your blood, and therefore how much oxygen is capable of being carried throughout your body. Normal hemoglobin is roughly 12 to 16 or so, depending on age and gender. Below 10 is where they start considering the possibility of transfusion, and below 8 is considered critical. 2.7 should be dead. Finally my time to shine. Hematologist here. I deal with leukemias/lymphomas, unexplained anemia, that kind of stuff. My favorite story to tell is of a patient, gonna call him Mr. X. Well, Mr. X is a 38-year-old patient who presented with swollen abdomen, extreme fatigue, peripheral edema and multiple enlarged lymph nodes. To paint a mental image, imagine a huge purple potato with toothpicks for limbs and inflated gloves for hands. Wasn't looking human at all. After a lymph node biopsy the diagnosis came, Hodgkin's lymphoma, HL. Now, HL is one of the few curable diseases if treated correctly. 6 to 8 rounds of chemotherapy, however the subtype was rather aggressive and with poor prognosis, so his chances were grim to say the least. One course of chemo is about a month, but seeing his status not improving after 2 weeks, half a round of chemo, he wanted to be discharged to die in his bed in his home, so he calls his friend to pick him up and off they go. 1 month later, a healthy-looking man, fit, groomed, approaches me and tells me he'd like to continue the chemotherapy because he's feeling great. I had no idea who I was talking to until he introduced himself as Mr. X. My jaw dropped to the floor and I sort of rushed to schedule his next rounds of chemo. I asked him what changed his mind about staying and he tells me that on the way home, after about an hour on the road he's got a weird appetite, so he asked his friend to pick up about a dozen cans of Spam, the European equivalent at least, and he just devoured them on the way home. Seeing that, his friend told him when they got home, well, X, if you can cram that shit in your stomach I'm pretty sure you can take at least 2 more rounds of chemo. So there he was, the living proof that Spam changes lives. So at the end of chemo, 8 rounds, he had what we call a complete response, a SA that lasts to this day, 5 years later, pretty much equivalent to cured in his case. No idea why I feel proud about his accomplishment, but it's one of my favorite story to tell. Too long didn't read. Guy gets cancer, guy gets a little chemo then rushes home, eats Spam, gets healthy and resumes his chemo eventually to get cured. Young man, early 20s, electrician, working on the roof of a 3-level new home build. His boss didn't supply harnessing and he fell onto a concrete pad below. Broke every bone in his face, both wrists and one forearm. I didn't meet him until 3 days later on the orthopedic ward where the nurses were calling him the boy who lived. One of the HP movies had not long come out. Honestly, he should not have survived, but he did by some miracle. His young wife was equal parts terrified and furious. Neither a nurse nor a doctor, but an EMTB working for a county 911 system. I was a crew of 2, both of us were EMTBs. We received a call for a 40-something male having difficulty breathing and some chest pain. Once we arrived on scene and walked into the door to his kitchen, he was sitting in a tripod position at the kitchen table about 15 feet from us. He was audibly wheezing and said it was really hard for him to breathe. Assisted him onto the stretcher and into the ambulance. gave the patient O2 and placed him on a 12-lead BP cuff and pulse ox, transmitted it to the nearby hospital and radio dispatch to try and have an paramedic unit meet us en route. Wasn't able to, so we made it to the hospital in about 5 to 10 minutes. When we transferred him from our stretcher to the hospital bed, he went into cardiac arrest. After the first round of CPR and cardiac drugs, they were able to sustain a pulse. After a few hours of running other calls, we were at the same hospital and the doctor said that that patient had a pulmonary embolism, widowmaker STEMI, and stroke, on top of him coding. As far as I know, he survived. A lady attended dead with her throat slit. She was unfortunately a domestic abuse victim and a vile man had cut her throat with a very large, sharp and jagged-edged knife. The wound was so horrific and deep, it still baffles everyone how she survived. But not only did she survive, she was conscious the entire time. Thanks to the quick actions of the paramedics, they were able to protect the airway and place a tracheostomy. Unfortunately, she has been left with life-changing injuries, unable to eat and fed via PEG, and left completely unable to talk. Doing my internship in a local hospital. There are multiple stories about unlikely survival/outcomes, about people who, in my opinion, are immortal beings that like to spite God. Several cases have burned themselves into my brain, but there's one that takes the cake. A 31-years slasher man was shot, then dropped at the local ER by the same guys who shot him. In total, he had 10 gunshot wounds across his thorax, abdomen, pelvis and legs. The bullets went through almost every single organ, and also broke a femur and a tibia. Needless to say, he was in hypovolemic shock and needed emergency surgery and blood transfusions. Look, I cannot tell you how much care has gone into his case. He spent 3 months in the ICU, and he's now at the surgery floor of the hospital. So far, he's had 25 plus surgical interventions, and counting, from 3 different teams and over 50 bags of blood. At one point, one of the teams realized they couldn't completely close his abdomen after one particular surgery, and decided to leave his abdomen open, and several surgeries later, he developed what we call hostile abdomen. The abdominal wall is scarred and everything inside is topped up with fibrous adherences/tissue, to the point that going in for yet another surgery is a hellish experience. He's also had multiple infections, both nosocomial and from his own digestive tract. One bullet entered through the abdomen, pierced his rectum and exited through one of his butt cheeks, and during the healing process, the wound became a fistula that continuously dripped pus and mucus riddled with bacteria in and out of the abdominal cavity, to the point he fell into septic shock twice. Regular antibiotics weren't doing their job no more, so infectology had to be called in regularly as he needed, and still needs, one hell of an antibiotic cocktail. Although he's still not completely out of the woods, at least the surgeons were able to successfully close his abdomen, his infection is currently under control, and his legs are finally healing properly. If you ask me, he'll probably live, if the local gangs don't invade the hospital and kill him before he's discharged, because it almost happened with him a month into his stay. Patient here. Last year I walked into the doctor's for a checkup and found that I had pretty much no red blood cells. Doctor kept me in the room an hour asking me questions and kept wondering how I'd managed to walk to the office alone, much less how I was standing in front of her and not collapsed on the floor. Apparently I had severe anemia for about 5-ish years and was just living with it. Coincidentally, the year prior my dog was in a similar place. We went to the vet. BC she was bleeding everywhere and come to find out her white blood cell count was literally 0. I don't know how either of us is alive right now, but I'm damn sure we're both happy to still be here. Also not a nurse or doctor, but a couple months ago I had a serious skydiving accident in which neither my primary or reserve parachute opened properly. The reserve wasn't even open halfway. Ended up with a shattered femur, open book pelvis, burst fracture on my back and some broken ribs. I will not be skydiving again, but I will be able to walk. My wife is a flight nurse and her fellow co-workers saved my life on the helicopter. skydive again to assert dominance over life. Guy came in with foot-long scalp laceration, several abdominal punctures and an 8-inch knife sticking halfway out of his sternum, still talking to EMTs during report. He was worked up, stapled up, discharged that night after they picked up his brother for doing it. No punctures to any organs, no card/palm injuries, no intestinal perforation. I don't know how. I sent him to the operating room. I was able to even consent the guy, which was surreal as I was on call trauma resident. An hour later they said it was the right call, but they just did conscious sedation and pulled it out with anesthesia and surgeons gowned S&D ready to intervene, and he was good for discharge as his police chaperone said it was safe. Subscribe and thanks for watching.